Okay, just a second. All right. Hello. Hi, everyone. Hi, guys. Hi. Okay, let's just wait a while. Hi. Oh, no wonder.
We don't do painting.
Okay, let's have the little bit of lights here. All right. Yes, yes. Hi, Mary Alam. Hi. We are on. Hi, good evening, everyone. We are on live on TikTok and also on YouTube. Okay, we're doing a concurrent streaming on both platforms. Okay, good to have everyone here. Okay, good, good, good. Hi, 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 hi. All right. Let me know where you're watching this video from. Okay, we're watching this live from, and I would appreciate if you can like this video. Okay, like this live. Okay, and give me some likes, and I'll appreciate that a lot. Thank you. Good, good, good. Okay. Yes, it's 8 p.m. Slightly late a little bit. Pardon me. Good, good, good. Good to have everyone here. Have you grabbed your breakfast, lunch, or dinner? Okay. Wow. Thanks for all the likes on TikTok. We're 1.4K likes. YouTube, okay, thank you also. Okay, 33. YouTube and TikTok likes, the way the likes are run are very different. Okay, yes, okay. Am I friends with Dental Digest? Yes, we know each other quite a while. Okay, when we started doing TikTok, and I think when he was starting his toothbrushing videos, that got my attention. That's why I also started doing toothbrushing videos back then. All right. Yes, yes. I'm from Singapore. Hi, hi, hi. And good. Hi, hi, hi. Good to have everyone here. Wow, good. All right. Hi, Aggressive Nature. Hi. Hello. Hi, Warren Cho. Hi. Good to have everyone here. Let me know if you have any dental questions. Okay. Good, good, good. All right. I'm in Singapore. Anthony is in Chicago. Okay. I'm 43 this year. All right. Good, good, good. Okay, good. All right, stop motion. Val is asking, okay, how do you use floss with braces? Okay, I don't have a braces model. Okay, to clean braces, you can use a floss. Okay, to use dental floss, you have to put this floss through this thing called a floss threader. A floss threader is don't have a floss threader. A floss threader is something you can thread through, then you can pass it underneath the metal brackets. So maybe you can look out on a floss threader. All right. Yes, yes, yes. Good. Thanks for the rose. Okay. Muhammad. Hi, hi, hi. Thank you, guys. Okay, good. I hope everyone is doing well so far. Let me know. Okay, and if you have any questions. We're doing live on TikTok and YouTube, and yes, I'm here to answer more questions. And yes, okay, yes, remember to brush 2 times a day, okay, and brush every night. Good. Okay, hello, hi Hakim, hi, hi, hi. Thanks for the likes. Shiti, hi, 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 hi. Thanks for all the likes. Okay, Radical, hi, and Shiti also likes all the likes. Okay, all right, good. Okay, let's answer some questions also. What is this interact? Okay. All right. So if you're on TikTok, okay, you can put all your comments in the comments in the questions section here. The one with the questions with the most like we'll be answering first, okay? And otherwise, I'll also be answering questions on YouTube and also on TikTok. All right. Okay. Fortnite Kid on YouTube is asking, what is the best toothpaste? Okay, the best toothpaste that we're looking at here, is there a best toothpaste? Actually, the two most important, okay, there's so many good toothpaste out in the market. See, I have a lot of different toothpaste here. There's so many different brands out in the market here. So what we're looking at here, the criteria for getting a good toothpaste, we're looking at here, basically there's 2 things, okay? 2 things, basically the first, of course, we're looking at getting a toothpaste with at least 1,000 parts per million of fluoride. Fluoride helps to prevent decay, so that's helped to prevent issue, okay? So fluoridated toothpaste would be a good idea. The second thing, of course, choose a flavor that you like, okay? Personally, I like a lot. I like minty toothpaste, so I stick with minty ones. So just choose something that you like. I think that's important. All right, and good. I hope I answered your question. Okay, Karina, hi. Good. All right. How do you cure cavities? Okay, if you have decay. All right. If you have a cavity, okay, there are different phases of decay. If the decay is very initial, okay, it hasn't formed a hole yet. Okay, this is called initial decay. If the cavity is formed, initial cavitation is formed, the enamel has demineralized but haven't formed a cavity, brushing and flossing well can help to reverse it. At the dental clinic, they can also use a topical fluoride to actually help to reverse the tooth decay. But if the decay has gone in and formed a hole, then early treatment will still be the best to get a filling done. Okay, late treatment can cause the decay to go deeper into the nerve, then causing things like a nerve issue. Then we will need things like root canal treatment and crown. Okay, so be a little bit more careful. Yeah, thanks for the super chat. Wow, we have someone who gave us a super chat just now. Did I miss the person? All right, thanks, appreciate that. AG the Pro, thanks for the super chat. Hi, good. Okay, thanks for the super chat and oh wow, okay. Thanks for confetti. All right, Muhammad Burhan. Thank you very much for confetti. This is the first time I'm getting it for confetti. Appreciate that. The gifts, okay. But more important, okay, the gifts are appreciated. But more important is the likes. I think likes and it's very much appreciated. The gifts is a good thing, but it's fine. Okay, I'm here just to answer some questions. Happy to answer your questions. Okay, let's see. All right. Ethan, okay, on TikTok asking, how much does braces cost? Okay, how much does braces cost? Good to check with your local dentist. In Singapore, in my dental clinic, our braces fee range from maybe 5,500 to for the traditional braces, okay, to maybe 8,000 for the invisible braces. So everywhere the fee structure can be different. So good to check with your local dentist on the fee structure. Okay, good. I hope I answered your question. Yes, if you're new here, my name is Dr. Tristan Pei. I'm a Singapore dentist with 16 years of clinical experience. Okay, so consider follow me on TikTok and YouTube, and good to have everyone here. All right, good. Yes, and thanks for subscribing. Okay, Mary, Alan, and yes, I'm in Tanjong Pagar, St. Andrew's Dental Surgeon. That's where I'm practice. Okay, and good. Okay, let's see. Let's answer some question. Can I use mouthwash instead of brushing? Okay, very good question. Can we just use mouthwash instead of brushing? Okay, there are two ways to clean our teeth. The first is the chemical. The first way is the mechanical way of cleaning, which is our brushing and our flossing. So chemical way of cleaning, brushing and flossing is more important, okay? It helps to clean the area better. The chemical way will be using a mouthwash. Mouthwash, I would say, is more of an adjunct. It's additional, adjunct is not the most important, okay? But the physical brushing and flossing will help to clean away all the plug, bacterial, food trap better. So mouthwash is adjunct. If you usually in the dental setting, I usually will prescribe mouthwash only when the gums are not ideally infected. But if you have a habit of using mouthwash and you like the taste of mouthwash, sure, you can still use mouthwash. All right, good. Can. Okay, Nicole Lee was asking, okay, asking, you can put your questions in the comment. I'll pin it up later. The questions with the most like will answer first, but I'll also answer some questions from comment. Can I eat my toothpaste, Nicole Lee was asking, can I eat my breakfast first before brushing my teeth once I wake up? Okay, that's a very, very common question. Is it better to, is it better to eat first or brush our teeth first in the morning? Okay, there is no, after being on TikTok for a while, I realized this is a question that many people have been asking, and there's no I would say there is no 100% right and wrong answer. Okay, so if you like to brush before you you would like to brush before you have your breakfast or have a breakfast then brush, both are equally fine, okay? Personally, I have a habit since young, my parents has been getting me to have my breakfast, okay? Brush first, then have my breakfast. So that's what I've been doing. So sometimes we're all creatures of habits, or some of the habits are all passed down from our parents. So nothing wrong, okay? If you want to brush before and brush or after meal is fine, okay? So as long as you brush 2 times a day, okay, and floss every night, okay? The 2 times a day and floss every night. So morning and night, okay? Brush 2 times, and why? Okay, so if you are brushing before breakfast, okay, if you brush before breakfast, you also have to clean away all those bacteria or maybe some of the usually bacteria on some of the things in the mouth, so you can eat better. All right, and if you want to brush after breakfast or after meal, okay, important thing is not to, if you're taking anything acidic, things like lime juice, lemonade, maybe sometimes orange juice is also quite acidic, okay? If you take that, then that can actually, if after taking anything acidic, you will brush immediately, that can actually wear away the surface of the tooth. And when the enamel wear off, you can see the dentine, the teeth tend to be a little more yellow, so don't brush too hard, all right? Yeah. And of course, wait for a good 30 minutes to 1 hour before brushing your teeth, okay? If you want to, if you have grabbed acidic food and drinks, all right? Good. Yes. Lana Loud, never brush properly. My teeth have plaque. All our teeth has dental plaque. So you are not alone, okay? Lana Loud, okay, good. Yeah, all our teeth has. So what we do is we just brush it well, okay? And this is our tooth itself, okay? Our teeth, healthy teeth, you see, the gums will stick to the tooth, okay? If over time, if we are not able to clean well, there's this thing called a plaque. This plaque is soft, so brushing and flossing can clean away. So if the gums are red, most people sometimes when the gums are bleeding, they tend to brush half the teeth. Must brush the whole teeth. When you brush it well, the gums will bleed, but you will get better. All right, also cleaning it well is important. Okay, all right, let's also answer some questions. Okay, let's see. Wow, too many questions. I saw TikTok and YouTube. Sometimes looking at 2 screens. Not easy. Bear with me, guys. Okay, and good. All right. Okay, good. Yeah, floss. Okay. Just I saw a question. Is it better to floss or brush first? Is that the question? Okay. Okay. Abang was asking, is flossing still required after a good brush? Okay. Toothbrush. Is flossing still required after a good toothbrushing? Okay. Our toothbrush only cleans the outside surface, okay, the biting surface, and the inside surface. So only clean 3 surfaces, outside, biting, inside. To clean in between, we have to use a dental floss. This is the lower. We have to use the dental floss. The dental floss, they can clean in between teeth. That's why brushing can only clean this much. You still need to get the floss to clean in between. All right, good. Yes. Electric toothbrush or manual toothbrush, which is better? Studies have shown that electric toothbrush does clean better. But the most important, it's not just the brush, but also technique. Okay, technique meaning, okay, when we brush, always have a habit of brushing 3 rounds. Okay, the first round we always like to clean the outside surface. Okay, so if I can run through, this is the method that I would suggest. Okay, to clean our teeth. Okay, so brush 3 rounds. Okay, brush morning and night 2 times a day and floss every night. So the brush 3 rounds. The first round is the outside surface. So when you brush the outside surface, we will go up and down. Okay, we will show you 2 methods. I will show you 2 methods. The first method is a simple method. So just brush up and down 5 times. 5 times up and down. 5 times up and down. Up and down. The main thing is to get the whole teeth up. This is the simplified method. Up and down. Up and down. By closing your mouth halfway, you can stretch the cheek. You can clean the back teeth a little bit better. So same thing for the top, up and down. Okay, up and down. Okay, then move to the other side, up and down 5 times. Okay, the first round is completed. The second round is to clean the biting surface. So start from the back teeth. Don't start from the front. You start from front, you might end up missing the back. So always start from one end. So brush 5 times. Okay, 5 times. 5 times, 5 times, 5 times, then go to the other end, okay? And for the top teeth, same thing, start from one end, 5 times, 5 times, 5 times, 5 times, 5 times, okay? So we have completed 2 rounds of our teeth, cleaning our teeth. The third round will be to clean the inside surface, okay? So the inside surface sometimes a little bit tough for the lower because of the strong tongue. So tough, but don't start here. It's very common sometimes we are afraid of reaching the back. Sometimes we start here. So always clean the back. So go 5 times, up and down. This is a simplified method. So up and down, up and down, up and down, up and down. Okay? 5 times. In top area now, inside method. So 5 times. Okay? So this is how we can clean 3 rounds. Okay? And the 4th round, of course, we would like to clean in between the teeth. Okay? But just now, we mentioned about the simplified method of brushing. Later, we'll talk about flossing. Of course, the best method or the gold standard in dentistry on how we brush, this is called a modified bus technique. This is what we dentists learn in dental school. Okay? It's not the simplest method, okay, but it's the best method. All right? So to clean the area here, we must understand that our teeth and gum, there is actually this thing called a pocket. Healthy gum, okay, will stick to the teeth better, so the gum pocket will be smaller, not so deep. When the gums are not so ideal, we tend to have a deeper pocket. So how do we clean the pocket then? Okay, we want to get our toothbrush 45 degrees to the tooth. Okay, this is 45 degrees. Squeeze the bristles into the pocket, jiggle gently, then brush upwards. Okay, one more time. 45 degrees, jiggle gently. Okay, get the bristles in the pocket, then brush upwards. So this is the 45 degree that we're talking about. We're showing you again. So the key thing about this is to get the bristles and upwards. So 45 degree and upwards. So this is the best way to clean. Of course. So we talk about brushing. Okay, so we brush 3 rounds. We've shown you the normal method and also the modified bus technique, the technique that we dentists use. Okay. The technique that we learn in dental school, okay, to be honest, practicality is not easy, okay. Sometimes I use the simple method, but of course, when the gums are red or inflamed, that's where you must clean it very thoroughly, get the bristles 45 degree. If you want the best method, then go with the modified bus technique. Then, of course, brush is outside, 3 surface, then the floss will be cleaning in between. Start from one end to the other, one end to the other. This is what you can do. All right. I hope I share with you some good information. Okay. If you like what you're seeing here, okay, consider subscribing. Okay, and follow me on TikTok and YouTube. Okay, and please like this video. Okay, and yeah, and ask me more questions. Okay, ask me more questions, and I appreciate that. I will answer as efficient and as much as I can. Of course, the best thing to do is to the best place to ask your questions is actually still with your in the dental clinic, with your dentist or your dental hygienist, dental therapies, they can actually look after you better. Customized care is still the best because everyone's dentition is different. What I'm sharing here is a very general information they can get on the internet, but we just want to share a little bit more so everyone have a little bit of better idea before you see the dentist. All right, okay, let's answer some questions. Okay. All right, okay, we have we have some questions coming up here. Okay, questions. Okay. All right. Silver not found us on TikTok. Okay. I'm pinning up this. How do you whiten your teeth? Okay. How do I whiten my teeth? Okay. There are a few ways to whiten your teeth, but first we must look at what are we dealing with. Okay. When we're looking at our teeth, usually there are 2 types of things we're looking at. One is that doesn't make the teeth pleasant. The first one, of course, is called the surface stain. Surface stains can be from coffee, tea, wine, curry. All this can cause surface stain. The second thing, of course, is the color, the color of the teeth. Okay, so we always deal with something more conservative first. Let's look at how we deal with surface stains first. To clean away the surface stains, we use a toothpaste. Okay, a fluoridated toothpaste usually has abrasive. This abrasive nature from a toothpaste will help to scrub away all those stains on the teeth. And when the stains are removed, okay, our teeth will look cleaner, whiter, and usually will look cleaner and whiter. Okay, it's a sense whiter but not whitening. But nowadays there's so many toothpaste saying that it actually has a whitening effect. Okay, but the whitening that we understand as long as you don't have hydrogen peroxide, you're not treating the inside the surface of the tooth. It's actually just to clean up the surface. If you clean away stains, of course the tooth will look cleaner. When it's cleaner, it's whiter. So what you can do at home, use a fluoridated toothpaste, you clean the area well and remove the stains. If the stains are too stubborn to remove, then of course you see your dentist for professional cleaning. Professional cleaning will help to clean away all the stubborn stains. Okay, this is always go for the most conservative. If you want whiter teeth, don't jump into teeth whitening immediately. Go with something more conservative first. Brush well at home, okay, floss, then see your dentist for professional teeth cleaning, okay. Once this is done and if you're happy with the color of the teeth, then you don't need to do anything else, okay. If after doing cleaning with your dentist is still not good enough for you, then what you can do teeth whitening, okay. So for teeth whitening, it's usually involve hydrogen peroxide or carbonate peroxide. So look out for this active ingredient. Okay, over here, I have, this is the over-the-counter whitening product that I'm using. Okay, I'm using a customized whitening tray. All right, this is a whitening tray over here, and of course you can also use toothpaste. So if after cleaning is not good enough, then there's two ways you can whiten your teeth. Number one is over-the-counter using whitening toothpaste. Okay, what are some of the whitening toothpaste that we're looking at here? This is Colgate Optic White. This is just one example. But the most important thing to look out for any toothpaste is to look out for the ingredient called hydrogen peroxide. We need to have hydrogen peroxide in the toothpaste in order, this one. Okay, over here, this mentioned 3% hydrogen peroxide. So usually over-the-counter whitening product has a good 1 to 3%, okay, which is more on the low level. All right. And a lot of toothpaste, they mention whitening, but if they don't have the hydrogen peroxide, carbonate peroxide, it's basically more for cleaning, okay? And after you clean up the teeth, of course, it look whiter. So they are also not right. They're also not wrong. I'll say they're also not wrong. So this is over the counter. You can use whitening toothpaste. The second thing, of course, at the dentist, you can see your dentist for chairside teeth whitening. Okay, they will put gel on the chair for 1 hour, then they whiten the teeth. Yes, I do play games. I play a lot of Mobile Legends. It become an addiction. So try to play lesser. But I love Mobile Legends, and usually I'll go back to that later. So this is whitening tray. Okay, so at your at the dental clinic, this is the method that I prefer the most. Okay, so at the dental clinic, they will take a mold on top and lower jaw. They make a tray that fits only to your teeth. All right. So with this tray, okay, you can apply the whitening gel. Okay, this is 35% hydrogen peroxide or higher concentration. Okay? So this is only for a good maybe 30 minutes to 1 hour of use. So you apply the gel, okay, on the tray itself. Okay, then after you wear it for a good 30 minutes to an hour. So you can do it every day for a good 2 weeks. So this is how you can whiten. If after teeth whitening is still not good enough, not whitened enough, then of course you can see your dentist. You can do other things like you can do veneers, you can do multiple crowns. Usually that's not so conservative, okay, because you need to shave the tooth, okay. But everyone has a choice as long as if that's really what you want, nothing wrong with that. Okay, I would always prefer not to. Why? Always good to go with a natural teeth, keeping them well. But if aesthetic is more important than anything else, because everyone's priority in life changes with time, with life, and if that's more important to you, you can do veneers, you can do crowns, okay, and of course it will cost a fair bit of money, okay, but you can instantly straighten your teeth if you do multiple crowns and veneers. The advantage is that you can almost instantly straighten your teeth. You can have very white color. Okay, so that's the advantage. Now the disadvantage is that you have to shave the tooth to make them smaller. And what you remove, you cannot add on. You won't grow back. So that's the disadvantage. All right, good. Yes, Okay, let's answer a question from YouTube. Can I eat my toothpaste? Okay, toothpaste contains a lot of other ingredients. Okay, if you are a child with growing teeth, if you swallow toothpaste, the fluoride in the toothpaste when we swallow can cause dental fluorosis or white patches or spots or lines on the teeth. Also, don't swallow toothpaste. Okay, excessive amount of a toothpaste swallow can also lead to stomach issue. Okay, so don't swallow too much. Okay, yeah, good. All right. Okay. What will happen if you never brush your teeth for 1 year? If you don't brush your teeth, dental plaque will form, cause gum redness. Then of course the gums will not be good. You will bleed a lot, and also don't spam. Don't spam. I understand. Okay. So brush 2 times a day and floss every night. Do brush your teeth. After watching my live and watching my videos and on TikTok and YouTube, one of the most important things, the things that I want everyone to bring back will be to brush 2 times a day and floss every night. Okay, not for my own good, but for everyone else good. Okay, having fillings is something we can do at the dental clinic, but I would like you all not to have fillings. Okay, how to? By looking after well. How to get everything well? Brush 2 times a day, floss every night, and of course, normal food is fine. Extremely hard things we don't chew, then things will last. Okay, your filling will last, your tooth will last, crown, bridges, everything will last for a long time. Maintenance is the key thing. All right. Okay. The brand. Okay. There's so many gel, but this is opalescent. Okay. This is the one. This whitening gel is actually through the dental clinic. So we can't really get high concentration. 35% is very high concentration. If you apply directly to your teeth and gum, it can cause can cause chemical burn. This is usually prescribed with the dental clinic with your dentist. So for higher concentration, you got to check with your dentist. Why is it important? Why can you get it outside and use it? Okay. Why is it important? Because at the dental clinic, the dentist will assess all the teeth. Okay, make sure there's no defective filling or severe gum recession and or any other dental issues before doing whitening. If there's any dental concern, if you wear the whitening tray, it can cause issue. For whitening, there's 2 concerns. One is teeth sensitivity, and the other one is gum soreness. So these 2 concerns are usually temporary and will go off. All right. Good. Okay, good. And yes, let's answer some questions. Okay. You have a couple of broken tooth. Okay, what should I do? Easy capital. So you have broken tooth. Okay, of course. Good to see a dentist to have them removed. Okay. Broken tooth can be sharp, can be hurting you, and usually it can also be a place that harbor bacteria. So good not to have that. Good. Thanks guys for watching. Okay, we have 18K likes now. Okay, let's go to 20K likes on TikTok and 73. Let's go to 100K. 100 likes on YouTube. Okay, and thank you. The pianist is asking, how do we deal with dental anxiety or fear of seeing a dentist? Okay. These are some of the things you can do to overcome fear to make your dental visit more comfortable. Number 1, arrive at the clinic earlier, okay, so that you will not be in a rush, you can be more relaxed, okay. Number 2, okay, you can bring a family member along, a good friend along, okay, to accompany you. That will help to make you more comfortable. Number 3, okay, do let your dentist and the front desk and the assistant, let as many people know that you have dental fear or concern. Why? Because then they can look after you well, they can give you VIP treatment, okay? They will know how to look after you better. So letting the people know that you have fear, then they will look after you better, all right? I always tell my patient, if there's anything I'm not so sure, or if you have any fear, let us know, okay? No one will judge you. In fact, I appreciate when my patient let me know that they have dental fear. Why? Then I can look after them better. When I can look after them better, then my life on a dental chair also will be better. Also based on for my own interest. That's why I want them to have a good experience. So communicate with the dentist is very important. Okay, and of course I will always establish. Maybe you can talk to your dentist, establish some understanding. So any point in time you want to break, if you feel that it's too tiring, you find that it's uncomfortable, you can always raise your hand. That's something I established with my patient. So raise your hand. I'll put a stop. Okay, then we will find out what's bothering you. We change. We do things a little bit different to make the area more comfortable. So these are some of the ways. You can also wear a earpiece. You can listen to your favorite music, but do let your dentist not too loud, so they can still communicate with your dentist. Good. Okay, I hope I answered your question. Oh, thanks for the 20K likes on TikTok. All right, and 76 on YouTube. Okay, let's go. All right, good. Yeah. Okay. Do I have braces? I have not done braces before. In fact, I have a missing premolar. Okay. There's also a little bit of fluorosis. Let's talk about toothpaste. How much toothpaste should we be using? All right. Let's look at toothpaste. Okay. So toothpaste. Okay. How much toothpaste should we be using? I have a lot of toothpaste. So the amount of toothpaste to be always good to use a toothpaste with at least 1,000 parts per million of fluoride. Okay. The amount of toothpaste we use, okay, will be for. It depends whether you can. The age of the child, okay? For children less than 3 years old, because they can't spit out yet, they tend to swallow the toothpaste. So good to use a fluoridated toothpaste to prevent decay, but the amount of toothpaste to use will be a smear layer amount of toothpaste. What is a smear layer? This is a smear layer. A smear layer or okay, this like that. A smear layer amount of toothpaste. This is for children less than 3 years old. Okay, a smear layer amount of toothpaste. Okay. Why? So that if they swallow the toothpaste, it will not cause any fluorosis or white spots on the toothpaste. Hey, the light's gone on the tooth. Okay, so for children less than 8 years old, when they can spit up, you can use a pea-sized amount of toothpaste. All right, this is the amount of toothpaste that we can use. Okay, so why the key thing is the main thing is still don't swallow toothpaste. Toothpaste swallow can cause fluorosis or white spots on the teeth. You see, I also have some white lines. Okay, so water fluoridation can also cause all these white lines on the teeth. Also, in Singapore, we do have a little bit more fluoride in the past. So quite a number of us in the population, we have a little bit of a dental fluorosis. There's no major harm. Mild fluorosis is just white lines. Major fluorosis, then we're looking at black. We can have black enamel defect. So not to have that. Yes, then the question is, pea-sized amount or fat gum? Okay. All right. Pea-sized amount of fat gum. Is it okay to have fat gum? All right, like Dental Digest. Okay. It's perfectly fine. Okay. You want pea-sized amount, you want fat gum, it's okay. Most important, don't swallow. But don't swallow the toothpaste. Okay. Pea-size is actually good enough. But if you really want to have, I mean, yeah, like Dental Digest, you want to brush like Dental Digest, then just don't swallow the toothpaste. Okay. And it's still fine. All right. Good. Okay. Question. Let's see. If anyone has any questions. Okay, let me just take something first. All right. Okay, good. Dental school, Mustafa Adele was asking how long does it take to finish university studying in dentistry. Dentistry in Singapore is 4 years. Okay, so 4 years in dental school. I was in National University of Singapore for 4 years. Okay, and yeah, do school dentists earn money? Yeah, everyone makes money. It's dentistry is a comfortable profession. Okay, for anyone who wants to be a dentist, it's a good profession. Okay, and in fact, a lot of professions are good. Yeah, a lot of professions are good. Okay, my name is Dr. Tristan Pei. Okay, and good. All right, good. Let's answer some questions. Will braces affect your jawline? Okay. Will braces affect your jawline? Usually, mouth movement will not affect the jawline. However, if you're looking at the construction, sometimes we're looking at more severe crowding, or the jaw relationship is different. When you undergo surgery, definitely will affect the jawline. Or sometimes if you take out some of the teeth and you move the teeth forward, then usually you also see some changes in the jawline. So yes, there are some. Good. Happy to answer questions. Okay, so let me know if you're watching this live. Thank you very much for being here. Okay, give me more likes. Okay, and follow me on TikTok and YouTube. I will appreciate that. And also ask me more questions. Okay, And gifts are appreciated, but not more important. Likes more important. Okay, give me all the likes. Okay, over here, and I appreciate it. And yeah, like this video and give me lots of like, and I'm very happy with that. Good. Thank you very much, everyone. Okay, I'm not the best person to deal with TMJ. But usually for TMJ, the first line that usually we will suggest is to get a mouth guard to, and also maybe some muscle relaxant. Okay, that's something that we can do. And usually if the TMJ issue is not getting better, I'll refer to my colleagues. There are a lot of dentists who are very good with TMJ issue. I'm not the one. I'm not one of them. All right, good. Wow, thanks for the 1K likes. Mido Titan. Thank you very much. Okay, all right. Okay, good. Goku067, you have root canal treatment twice. Sorry to hear about that. Okay, yeah. So brush well, floss well. Yeah, sometimes unfortunately certain things also beyond our control. So just let's just look after everything well. Okay, which toothpaste is better? Okay, normal or electric or electronic? Okay, study shows that electronic toothbrush are better. Okay, what are the dyes they use for disclosing tablet? From what I read, is actually vegetable dye. Which dye? I don't know. But these are apparently harmless vegetable dye. Disclosing tablet, I also used it when I was in a very small child, maybe like 8-10 years old in the past. In our local schools, when I was a young boy, we also use disclosing tablet. We were given that so that we can see where the dental plaque, so they can brush better. I still remember when I was young, maybe like 8 to 10 years old in school, we will be lining out along the drain in the school. Then we will be getting our toothbrush and a mug. Then we'll be brushing our teeth. And and sometimes they also give us disclosing tablet to chew. Then we can see. Then we brush also. All right, good. Thanks for all the questions, guys. Okay, 24.7K likes on TikTok. Let's go to 30K. Yeah. All right, and yes, let's answer some questions. Okay, questions are most like. Okay, all right. Okay, doctor, why I have a black spot on my teeth? Okay, why Muhammad Faha was asking. Okay, why I have black spots? Okay, black spots on the teeth can be due to many reasons. Okay, number one, it can be due to decay. Okay, if it's dark spots, it could be due to decay. If it's decay, then of course, good to see a dentist earlier to get a filling done. Okay, and dark spots could also be just stain. Okay, if it's stain, then seeing a dentist for cleaning, then that's also fine. So what you can do at home, try cleaning it better. Okay, and try cleaning it better. Of course, if it's not getting better, the black spot's still there, then of course see your dentist to do a clean, to do a check. Okay, and if it's just a stain, by cleaning it, we'll solve the issue. Then don't need filling. What else can it be? It could be also a old filling. Yeah, it's discolored. Old filling that discolored, or there could be some slight leakage, or sometimes colored dyes into the filling itself. That's why you see some darkness or around the filling. That could also be the reason. All right. I hope I answered your question. Okay. Good. Not so sure. Always good to check with your local dentist. All right. Okay. Miss Aries is asking, my teeth is making my mouth extremely painful. If your teeth is hurting you, okay, and it's extremely painful now, what you can do is to brush the area well, floss the area well, use the modified mask technique that I've shown you just now, angle the toothbrush 45 degrees. Okay, if the area is hurting you, angle the toothbrush 45 degrees, especially the area that's hurting you. Squeeze the bristle into the gum pocket, jiggle gently, and brush upwards. If the gums are not ideal, clean it well. Okay, and you can use the mouthwash also. If it's still not getting better, of course, if this side is hurting you, chew on this side, then best is to see your dentist. Or let them have a look for you, then to see what's the issue. Sometimes there could be so many possible concerns. Extreme pain on the back area could also be wisdom tooth. Yeah, there's unfortunately so many possibilities. Sorry to hear about that, Miss Eri. But good to get help, seek help from your local dentist. I'm sure they can look after you well. All right? Okay, take care. Okay. All right, how to get whiter teeth? Okay, just like I shared before. Brush at home well. See dentist for professional cleaning. If still not good enough, then of course you can do teeth whitening, either over the counter, chairside whitening, or customized whitening tray. If still not good enough, then use crowns or veneers. Okay, this is the sequence. Start from the most conservative, then to the most not conservative treatment. All right. Good. Yeah, wow, 26.1k likes on, and wow, we have so many friends on TikTok and YouTube. Good to have everyone here. Thank you very much. Okay, which is better, mouthwash or toothpaste? I don't know how to mouthwash or toothpaste. Okay, mouthwash or toothpaste, mechanical cleaning more important, so brush and floss more important. Mouthwash is optional. That's just my own feel. Okay, mouthwash is more of a adjunct. It's a chemical way of cleaning. So to simply put, okay, if you want to clean the floor at home, okay, which is more important? Getting a brush to scrub it, or using a Pauling detergent over the area. The mechanical scrubbing is more important. Using a mouthwash to just swirl around the area is a chemical way of cleaning, but the physical scrubbing, brushing and flossing is still the best. Okay, so nothing can beat that. But most people like mouthwash because of the fresh smell or fresh breath after that. If you like that, sure, why not? Okay, everyone have a choice. I'm not a fan. I don't use a lot of mouthwash. Usually when the gums are, if the gums are not ideal. All right. Okay. What if you just brush once a day, every night? Is it okay? All right. In order for tooth decay to form, okay, you need a good 24 hours. All right. That's from studies and research. Okay. So if you brush once a day, theoretically no issue. Okay. But all right, why we do 2 times a day? Because not everyone can brush ideally. So good to have brush 2 times a day so that we do a little bit more, so there will less issue. American Dental Association, okay, they actually suggest brushing 3 times a day. All right. For myself, I do 2 times, morning and night. Okay, so that is everyone has just have a choice also. All right, good. I hope I answered your questions. Okay, good. Thank you. Let me know put all your questions in. I want to answer your questions for you. All right. Can I suggest? Can you suggest what's the best toothbrush? All these are all very good toothbrush. Okay. All these are all very good toothbrush. Okay. Okay. So, what are the best toothbrush? Choose a toothbrush that is soft. Okay. And just choose a toothbrush that is soft and a design that you like. I think that's more important. Okay. A design that you like, that you enjoy brushing. I think that's the most important. Of course, electric toothbrush more fun, but choose a character that you enjoy or you like. I think that's good. And the most important is not the brush. A soft brush is important, but more important the technique. Okay, and to clean all 3 rounds, outside, biting, inside surface, and also the floss. If you clean all around well, no bacteria, no food trap, how to have bacteria, no food trap, how to have decay. No decay, also the gums will be pink and healthy for life. Then you keep everything well. All right, good. All right, good. Yes, hi. Okay, should we floss before or after brushing teeth? Okay, who is asking this question? T-Y-N-E-Y. Okay, should we brush? Where is it? Should we brush before or after? I missed the question. Okay, should we floss before or after brushing teeth? Okay, should we floss before or after brushing teeth? It doesn't really matter, okay, if you already have a habit of brushing and flossing, okay? But if you haven't have a habit of flossing, then floss first, okay? Why floss first? If you floss, because we already have a habit of brushing, so you will not miss out brushing, so you can brush 2 times a day, you will not miss out. So if you floss first, then after you brush, then you won't miss out flossing. But if you already have a habit of brushing and flossing, it doesn't really matter. You can brush first then floss, or floss first then brush, it's fine. Okay, so that's how I interpret it. But yeah, or if you brush your teeth, okay, it's bleeding. How to brush your teeth without bleeding? That's a very good question. All right, and who asked this? The cute buns. You ask good questions, but don't spam. All right. Okay, how to brush teeth without bleeding? So, see, first we understand why the gums bleed. Okay, healthy teeth, when you brush, will not bleed. This is called healthy teeth and gum. The gums will stick to the teeth. Okay, and but if you are not able to clean the area well, the gums, there will be this thing called plug. Plug, we can normally brush the area well, but if you brush half the teeth, okay, then things get stuck. If you brush half the teeth, okay, we don't clean the whole area, then the plug over time will harden to form stones. Tatas will actually cause more gum redness, and got more gum redness, the gums will bleed and it will go down. So if the gums are bleeding, how to not have bleeding is to brush the whole teeth. But when you brush the whole teeth, it will bleed. Remember the 45 degree that we mentioned? You want to angle the toothbrush 45 degree to the tooth, get the bristles into the pocket to clean it. This is what you can do. Also, the floss has to go underneath the gum. Okay, and when you clean the area well, if it's bleeding, keep cleaning. Okay, it will bleed. When you clean well, when you keep cleaning well, it will go down. After 1 to 2 weeks later, eventually no bleeding. However, if the bleeding is still not getting better, of course, you still need to see a dentist for regular cleaning. Okay, they can clean at the dental clinic. They can remove all the tatas. Once the tatas removed, okay, the tatas will attract more, because they are rough, they attract more bacteria, more plaque, then they can cause issue. Okay, all right, okay. GPA channel, you're welcome. Okay, happy to share some of my dental knowledge. Okay, good. It's disclosing tablet sweets. Yes, disclosing tablets are sweet and tasty. Okay, but they're not for eating. Okay, it's for biting, swirling. Okay, and then spitting out, so that the vegetable dye will actually help to color up the dental plaque, so you know where to brush better. All right, good. Okay, where's my dental? You can check out the link in my bio. Okay, I'm from St. Andrew's dental surgeon. Okay, I'm a dentist over there with, I think, 17 years. Somehow I lose track. I think since 2000, about 17 years of clinical experience. All right, good. Yes. Yes, follow me to learn more dental tips. Yeah! We have 30K likes on TikTok and 104 likes on YouTube. Yay! Thanks everyone for liking the video and asking all the questions here. We're so excited to answer your question. Good. Yeah! Let's just have some fun, guys. Good. All right. Tom, Helen, Edith. Hello. Hi. Lima. Hi, Galaxy. Hi. Good to have everyone here. All right. Good. Yeah, reported cute buns. Yes, he does spam a lot. Okay. White strips, whitening strips, good. Whitening strips. In Singapore, we hardly have whitening strips. I think in the US, you can get white strips. The American Dental Association actually recommend white strips. I think if you do it proper, will still be fine. But there's so many ways to whiten teeth. That's just one method. The method I prefer is still the whitening tray. This is customized whitening tray. They are fit only to your teeth. This is the bottom. This is the bottom tray and the top tray. Okay, this is the bottom and the top tray. This is how we can. This is the method I prefer. Okay. Answer question. Okay, please answer my question. What is your question? At math. I can't see your question. Please answer my question. I find the question. Please answer my question. Oh, how to find the question? I want to answer your question. Okay, let me know your question. Okay, please answer. Also answer my question. Okay, answer more question. Okay. Okay, let's answer question. Okay, I have stones under my tongue. Okay, what do I do? Okay, these are also known as tatas. Okay, these are called mineral deposit. Okay, it's actually on the inside or the back of the front teeth. Or usually saliva usually pull around over here. Okay, and when saliva pull around here, usually deposits form quite fast over here. So this is one of the spots that tartars build up quite fast. So what you can do, you can brush and floss the area well by cleaning away all the dental plaque. They will not harden. The stones form will be slower. However, no matter what we do, it will still form. So what you can do is to see your dentist for cleaning. Okay, that's the way you can remove all the tartars. And 6 monthly cleaning to maximum 1 year. That'll be good. Okay, answer question. Okay, surprise Grover asking, what if I don't brush for 1 year? Don't brush, dental plaque will form. Plaque harden to form stones. Stones attract more plaque. More plaque, more stones will cause gum redness. More gum redness, more swelling, the gum will go down, the bone will go down, then we have gum recession. Then over a long period of time, the gums go down, the bone go down, then we have shaky tooth. Then we have tooth loss. Okay, so brush 2 times a day and floss every night. Okay, everyone? Good. And good. My father say if I keep flossing after eating, it's good. Okay, so good to floss once every night. All right, good. I'm clearing some of the questions on TikTok. Okay, and what if I don't brush for? Brush. Yes, brush 2 times a day. Okay. Shizzy202, why my teeth drop so easily? Okay, so this is a very good question. First of all, we must know usually the teeth that drop easily is the other milk teeth. Okay, so this is actually a picture of an adult teeth. Imagine this is a milk teeth. Okay, a milk teeth, adult teeth will come out. When adult teeth come out, usually the milk teeth will be on top. This is a milk teeth. Imagine the milk teeth. The adult teeth will come out. Okay, they will push the root, and what will happen? The root will actually dissolve. So when the root dissolve, it's like melting. So now there's actually no root. So when there's no root, what will happen? When you eat something, this will start to shake. So usually when you take out your milk teeth, you only notice is the top shell. So without the roots, imagine the adult teeth keep pushing, and now it's only the shell. So that's why the milk teeth come out so easily. You can take it out. You can get your parents to take out for you. If you're comfortable, if not, they can also come out by themselves. So usually that's what a milk teeth is. Okay, good. That's why it's so easily. If you like what you're seeing here, guys, remember to follow me on TikTok and YouTube. Okay, and thanks for all the likes. Okay, likes appreciated. Okay, gifts not the most important, but likes. Please like this video. Okay, and we have 31K. Let's go for 40K likes. And 112. Let's go for 150 likes on YouTube. Yeah, thank you. Let's answer question. Answer question is more important. Okay, it's all about not about me. Okay, is it okay to not to have a completely white teeth at all? Okay, how white is white? Okay, healthy more important. So how white is white? It all matters to the person. Okay, beauty lies in the eyes of the beholder. Of course, whiter teeth does appear more confident, looks more pleasant. That's what society dictates. But end of the day, if you're happy with what you have, it's fine. Do you need to do braces? If you're happy with alignment, you don't need to do braces also. Okay. But yeah, this is just my thoughts. So yeah, you don't need to have complete white teeth. My teeth is not completely white. It's a little bit yellow. I will feel that my teeth is white, but some people say it's very yellow. You can't please the whole world, guys. Okay. Can't please the whole world. Even though I thought my teeth is white, but anyway, it's okay because everyone are different culture. Okay, we're looking at when we're on TikTok and YouTube, we are facing a very wide variety of audience. Okay, in different part of the world, this is considered yellow, but in some part of the world, this is considered white. In America, I think their gold standard is different. That's why I have patients who come and see me. Some are from America. Wow, their teeth is so white, and they want whiter teeth. I was like. But it's different. It's very different. Okay, so let's answer question. Okay, pardon me. I got a little bit more attached sometimes. Put all your questions in. On the YouTube, TikTok. I'll come back to the questions here also. Okay, recently have a deep scaling, teeth sensitivity. Abang was asking. Okay, what is deep scaling? Okay, normal cleaning. You clean like this. You clean maybe on the top surface. Scaling on the top surface, remove tatas lah. Deep scaling means if you haven't seen a dentist for a long time, the plug hardened to form stones. Stones are very deep. Then this is deep scaling. Deep scaling involving scaling the root area here, and this is where there is dentin. Our teeth has 3 layers: enamel white color, enamel is white color, dentin is the second layer, third is a nerve. So the area that's sensitive is actually the dentin area. So when you do deep scaling, you clean away all those tatas. Of course, we'll feel a bit sensitive. That's actually very normal. So what you can do after deep scaling, okay, brush well, floss well, get the gums to stick back to the teeth. Okay, so if the gum can stick back to the teeth, then less sensitivity. But if it's sensitive after the procedure, I'm sure your dentist will suggest you Colgate Sensitive or Sensodyne or any toothpaste for sensitive teeth. The potassium nitrate from the toothpaste will actually cover up the tubules. Will cover the tubules on the dentin. That will help to reduce sensitivity. All right. Okay. Good. This is just an aid that provided by Colgate lah. Anyway, it's yeah. I've been using that now. So yeah, good. Answer question. All right. Do you brush your teeth for 2 minutes? Okay. Good to brush 2 times a day, morning and night, and 2 minutes each time. Okay. 2 minutes is a guide. Okay. The most important is to clean all the surface. The outside surface, the biting surface, the outside surface. Okay, always start from one end, clean to the other end, one end to the other end. Outside surface, biting surface, and the inside surface, and of course to floss. Okay, if you clean all around well, okay, that's more important. If you can clean fast, sure. But as long as you clean all the area, I'm fine with that. But 2 minutes is a good gauge. All right. Thanks guys. Okay. Answer question. Okay. Yeah. Yes, brush your teeth for 2 minutes. Okay. Good. Someone asking, do you eat toothpaste? Do not eat toothpaste. Okay. Do not eat toothpaste. All right. Eat food. Okay. You want to eat, you can eat sweets also. Okay. You can take sugary food and drinks by limitation. Okay. Sugary food and drinks can cause sugary food and drinks, okay, as long as we clean it away, it will still be fine. If you want to take them, you can, but limit during meal times and decrease frequency. If you take sweets, if you want to take sweets, if you take sweets every minute, every 1 hour, keep munching sweets, and you are creating an acidic environment in the mouth. The acidic environment in the mouth, because of the sugar will be eaten by the bacteria. The bacteria eat the sugar, will produce acid. This acid will break down the enamel of our teeth. Okay, and break down the enamel of our teeth and can cause decay. So that's why if you only take sweets for a while and you clean it away, or you take sweets after meals, okay, then you clean it away, you limit the intake, then the acidic food will not be on the teeth for so long, then there's less chance of having issue. Okay, tooth decay also won't happen so fast. Usually it takes a good 24 hours. Approximately 24 hours for you to start. So brushing 2 times a day is actually fine. You can still eat your sweet. Okay, I love chocolates. My weakness is chocolates. I used to eat a lot of sweets when I was young. Okay, I had no decay. Okay, and as long as you brush well, floss well, we'll be fine. All right, good. Answer question. Okay. Okay, if I answer question, please give me more likes also. Thank you. Likes this TikTok, and yeah. Thank you everyone for being here. Consider following me on TikTok and YouTube. Okay, I don't do a lot of. I do some dental videos. Okay, but mainly I also do some ASMR, more fun videos, more for my own entertainment. All right. And anyway, thanks everyone. Okay, how long does it take to finish studying for dentistry? 4 years in dental school. In Singapore, study 4 years dental school. Then after we were born to the government for 4 years. Okay, I came out after after about 2 years, I came out. So I bought my bond, then I came out to private practice, so I started a little bit earlier. All right. Thanks for the roses. Okay. DV3. Oh, thanks for the rose. Good. Awesome. Okay. Good. Yes. Answer some questions on YouTube. Okay. My teeth bleed. Can I brush my teeth? If your gums are bleeding, brush it well. Okay, don't brush half the teeth, clean the whole teeth. If it's bleeding, keep cleaning well. You will bleed, but when you keep cleaning well, it will get better. Okay, of course, if it's still not getting better, see your dentist for a good check. All right, good. How to be a dentist without going to dental school? Everywhere is everywhere. How to do clinic? How to go be a dentist without dental school? Yeah, I guess different country has different rules. Good to check the regulation, but in Singapore, definitely dental school to do dentistry. Yeah, definitely we need that. All right, good. This is not pre-recorded. Okay, why? Because we're doing YouTube live and TikTok live, okay, concurrently. So sometimes you see me looking at you here, and I'll be looking at you on TikTok and also on YouTube. Also, that's why you'll see me sometimes looking at different angle. You can check me out on the other platform and follow me on the other platform, on TikTok and also for YouTube. All right, thanks for following me on both platforms. Okay, pardon me. All right, good. Yeah. Good. Why do I always get cavities even though I brush every day? Okay. Me was asking, okay. If you get cavities, what causes cavity? Okay, so in dental school we learn 4 things. 4 things must happen at the same time in order to have tooth decay. Number 1, we must have bacteria. Number 2, we need to have sugar. Number 3, we need to have tooth. Number 4, we need to have time. Okay, so these 4 things come together, then we have tooth decay. So you can remove one of them, then decay will not happen. Okay, if you look at the first thing is the bacteria. If you can brush all the surface well, no bacteria, no food trap, how to decay? If you limit sugary food and drinks, okay, if you can clean away all those sugar, or you limit intakes of sugary food and drinks like sweets, all this, if you limit during meal times or take less, then there's also less chance of decay. No tooth, of course, no decay. And time, okay? Time, if you can clean away all those sticky food after you eat, then no decay. So it's actually quite simple. So as long as, if you take anything sticky, then scrub it. No toothpaste is fine also. Just scrub the sticky part away from the biting surface. Usually, sticky food like caramel, all this can stick. And when they stick on the teeth, it can be for a while. And imagine sugar stick on the surface of the tooth for a whole day. That is actually like feeding the bacteria sugar. Then the bacteria produce acid, then it will break down the enamel. So that could be the reason. That's the reason. Also brush well, guys. Okay, good. Ask question. Answer question. Does teeth grow in gum? Adult teeth will push the gum, they will come out. Okay, I think that's all I know. Okay, electric toothbrush or manual toothbrush better? Electric toothbrush does better than the, from studies and literature, electric toothbrush are better than the manual ones. Okay, but more important is the technique. Okay, brush 3 rounds outside, biting inside, floss in between, one end to the other. Don't miss anything, and everything will be good. All right, good. Answer question. At math asking. Yeah. Okay. Answer question. Okay. F math. So many questions. Okay, let's answer question. We have so many questions. All right, good. Okay. What toothpaste brand do you recommend? Ben is asking, what toothpaste brand do I recommend? Any toothpaste with at least 1,000 parts per million of fluoride and a flavor that you like. Okay, I like minty flavor. If you like grape, you like orange, you like any flavor, just go ahead. Just choose a flavor that you enjoy. Then you'll be happy brushing. Then you can brush 2 times a day. All right, that's my rationale. Good. Okay, root canal. Okay, what is root canal treatment? Okay, this is root canal treatment. If decay goes into from the top, it goes into the nerve breaks down, will form a abscess. This is something like a pimple. Like a pimple, this is a infection. So this is due to the breakdown of the nerve. So root canal treatments means you open up a small hole from the top of the teeth, you clean up the canal. Okay, then after you clean the area, you put root filling, then you do a crown over the tooth. That's called root canal treatment and followed by crown. Thanks for the roses. Okay, at math, thank you. Wow, thanks for the roses. Wow, thanks for the 3 roses. Okay, wow, so many roses. Thank you. Okay, thanks. And good. Answer question. Let's answer some question. All right. What toothpaste brand do you recommend? I say that right. This is a repeated question. All right. Max is asking, okay, that you love me, Doc. Thanks for the love, guys, and I love y'all too. Okay, stay well and awesome. All right. Good. Can you be put to sleep for root canal treatment? Usually root canal treatment, we don't need to put you to sleep. We just need to numb the area. After we numb the area, when the area is numb, you won't feel anything because for root canal treatment, the tooth is still staying there. We're not taking out the tooth. It's usually a painless procedure after you numb the area. Painless procedure after you numb the area, so you won't feel anything. In fact, I have some patients who also fall asleep when we do root canal treatment. Wow, thanks for the, what is this? It's a wishing, first time I've seen this, wishing bottle. Thanks for the wishing bottle, FMS, and wow, thank you very much. Yeah, wow, so many wishing bottles. Thank you. Yes, Eric, okay, I'm a fan of Dental Digest. Yes. I must confess, I've not been watching his video a lot recently. Yeah, I don't know. I mean, he makes amazing video. I'm not watching a lot. I still love him. Okay, in a way that I like the way he brush teeth. I learned a lot from him also. Okay, yeah, not watching a lot recently. Yeah, previously I was addicted to all his video. Yeah, I don't know why, but I think just I still occasionally go back. Yeah, I love to. Yeah, I miss the time. I was so addicted to Dental Digest video. I keep watching and keep doing videos and soon I'll find some motivation. Now I'm addicted to doing ASMR. I know not many people like ASMR, but I like doing it. So that's why bear with me. Soon I will do something else. All right. Thanks for the GG and fire. Wow. Guys, thanks for all your support. Yeah, almost 40K. Let's go. 40K likes on TikTok. Yeah, wow, 131. 150, let's go. 150 likes on YouTube. Thank you very much, guys. How to remove dental plug? Okay, dental plug is soft. Okay, dental plug is soft, so brushing will help to clean away dental plug. So brushing will help to clean away dental plug and flossing. Main thing is to clean it. But if dental plug over time harden to form stones, your brush cannot clean. Or your brush and the floss can't clean, you have to see a dentist for professional cleaning. So don't wait for the plug to form. Okay, clean it early. Answer question. Okay, XC. Wow, thanks for the fire. All right, at math. Oh, good. Jo Adu Puhasan. Okay, thank you very much. Okay, glad to share my dental knowledge with everyone here. Okay, talk. Hi. Okay, does braces hurt? Okay, when you just put on braces or when you have adjustment for braces, there will be some slight discomfort because there's actually some pressure applied to the teeth. So the pressure applied on the teeth will cause some discomfort, usually for a good how long? For a good maybe 4 or 5 days. Okay, rarely it goes after a week. All right, good. Yeah, wow! Thanks for the 40K likes, guys. Hooray! Thank you. Good. Yeah, follow me to learn more dental tips. Also see some of the funny videos or the videos I'm doing. Some are educational, some are more for fun. All right, nice, good. How to get white teeth? I think we answered this question already. Okay, brush, clean, brush well. See your dentist for cleaning. Okay, then chair side teeth white. If not clean enough, then you can do whitening. Okay, home-based whitening or chair side teeth whitening or a customized whitening tray. It's still not good enough, then you can do veneers or crowns. Okay, good. Answer question. I try to answer as much questions as I can. Okay, why did I feel pain when I was doing root canal treatment? Okay, root canal treatment normally don't feel pain. However, okay, if the nerve, we see when we numb this area here. When we numb the area here, usually this stretch is numb. However, sometimes when the nerve is very infected, this is what we call a hot tub or hot nerve. When the nerve is very infected, the numbing, we numb here, but the nerve inside is not numb. So what we have to do, this is the this is the thing that we don't want to. When the nerve is very infected, we have to numb straight from the canal. And once we go into the canal, we put in the numbing solution into the area. You will feel maybe 2 to 3 seconds uncomfortable. After that, then you will numb well already. But the process of going in to numb it is not the most comfortable. Yeah, so yes, root canal treatment. But once you numb the area well, okay, then you don't feel anything. Let's call root canal treatment. Okay, good. All right. Okay, I'm 43 this year. I'm not 80 years old. All right, good. And good. All right, how am I today? I'm doing well. Good. Thanks everyone. Good. Okay. What are the good effects of using? Daniel Justin was asking, what's the good effect of using mouthwash? Chemical wash will help to clean away the dental plaque, okay? But the brushing and flossing is still the best. The best thing I can think of mouthwash is maybe the fresh breath, okay, from using the mouthwash. Okay. Why does my teeth hurt after eating acidic candy? If your teeth hurts, it could be there could be some concern. Okay. Try brushing the area well, flossing the well. If not, better see your dentist for a good check. Good. All right. Let's see. So many questions. Wow. How's everyone doing? All good? Yeah, you look like this John 2-inch gang. You look like a very nice guy. Yes, I am a very nice guy. All right, good. Okay, let's see. Where is the question? All right, okay. What if I brush my teeth for 1 hour? Okay, the local Michelle is asking, if you brush your teeth for 1 hour, should we be cleaning certain surface? Should we be cleaning a table for 1 hour? Of course not. If you keep cleaning a surface over a long period of time, that can also cause wear. Enamel is the strongest, but you can be quite surprised that when we are very persistent in cleaning, we can brush very hard every day and night. The surface of enamel can wear off. Also, don't clean for 1 hour. All right. The key thing is being thorough, not strength or not length of time. Reaching all the surface more important. Okay. Good. All right. Okay, Vibes asking, why do teeth grow at random places? If the teeth come out in random places, usually means it's crowded, it's not able to come out properly, then good to see a dentist to have a look. They might be able to use braces to move the teeth in a line, to align the teeth properly. Usually that means crowding when there's not enough spaces. Good. All right, guys, okay. We are past 9. So, okay. Yeah, we are past 9 and thank you everyone for being here. F math. I can't add math. I can't find your questions. Okay. Maybe you put your questions here. You've been giving me quite a number of gifts. Yeah, put your question, F math. I'll answer your question over here. All right. I can't find it. All right. Anyway, thanks everyone for being here. Okay. F math. Can it help with receding chin? Receding chin. Okay, receding chin. Can braces help with receding chin? Okay. Receding chin usually means it's a class 2 occlusion, means the top jaw. Okay, this is a normal bite. The front is over the lower. A receding chin usually means it's all more backwards. Okay, so can braces treat the receding chin? Braces sometimes can affect the jaw relationship. Honestly, I don't have a lot of knowledge with braces. Okay, they move the teeth more. Braces help to move the teeth more. It doesn't really help the chin dot, not as much that I understand. Yeah, it's more teeth, more teeth movement from my knowledge. Your question, no answer. Sorry, okay. I'll answer all the questions over here as much as I can. All right, good. Thanks, guys. Okay. Good. Okay. Anyway, yeah. So I will see you all then.